European Public Health Alliance, or EPHA in short, is a large Brussels-based public health advocacy network, and we're representing primarily the interests of ordinary people and of citizens. Our membership is really diverse, and that includes issue-specific organizations, disease-specific organizations, representatives of healthcare professions, vulnerable groups, and crucially also a lot of national NGOs working together on different aspects of public health. I think the particular people perspective that EPHA is offering is really important also for the research community. And that is not only because we can provide sort of data and lived experiences from the ground, but also because we can help the research community to sort of translate their findings into policy messages and advocacy actions. And because we represent the voice of the people, we can probably be a little bit more activist-y than the research community can be. The complexity of public health has become clear to everyone, and also how public health is linked to the economy, to the environment, to technology as well, and so many other policy domains. And obviously, in combination, this is a whole range of topics that need to be covered. And we can only work in partnership, whether it's with EUPHA or other organizations, in order to make sure that all these important issues and matters are indeed covered by us. With EUPHA in particular, we've been working on issues such as NCD prevention, the commercial determinants of health, the digital transformation of health and care, and right now we're also looking at the new EU funds for health to make sure that they can generate better health outcomes for all. Policymakers, I think, are also looking much more now for effective coalitions and synergies between different areas and actors. This new world that we're operating in, it's really interconnected, and we need to make sure that we all work together effectively.
There's various tools that we apply at EUPHA. We have, for example, our e-collections, and e-collections are collections of 8 to 12 publications from the European Journal of Public Health, our journal, and we collect them on a specific public health topic and accompany them with a newly written editorial. And this editorial is written in a way to give a brief overview of the recent evidence that has been published, and it has been written taking in mind the policymakers and decision makers. We do statements whenever there's an emerging public health issue to quickly get the public health perspective out there. We have been developing the EUPHA Rapid Response Team. This is a team of 40 or so public health experts that are 24/7 available to give the public health evidence and the latest evidence on an issue. We always work from an evidence-based perspective. Our aim is that through this advocacy work, we spur change and action. And actually this cycle of analysis of the scientific evidence towards advocacy and in the end action is our new EUPHA strategy for the coming 5 years. EUPHA, as a European level organization, works on national and regional level by collaborating with our members. Our members are national public health associations and societies for public health. Through collaboration with our members, we provide advocacy guidance, more general advocacy guidance, as well as support specific activities from our members on national and regional level. When our members organize national events, we can provide support for those events, maybe international European speakers. Through our Brussels satellite office is another way of supporting national and regional level advocacy. In Brussels, we advocate for what our members are asking for on national level.